Hello and welcome everyone to today's HIPAA 101, your essential compliance training webinar. My name is Jacob Borkover here on the webinar team at Rectangle Health, and I want to thank everyone for taking time out of their day to be here with us today. We've got a great presentation for you today, but before we jump into it, I'm gonna give a few quick housekeeping items. At Rectangle Health, we simplify HIPAA and OSHA compliance for thousands of practices all around the country, in addition to providing payment solutions, patient engagement, and a bunch of other great features for medical and dental practices all across the country. I'm really excited to be hosting today's CE webinar. Always get questions about the CE. So we are PACE accredited through AGD. This will be for AGD subject code 566, and this will be valid for one CE credit. So in order to get the CE credit, you need to be on for the duration of the presentation today. And then you also need to be participating in our polling questions that we'll have throughout the presentation so that we can verify your attendance and that, of course, that you're paying attention. And those CE credits will come your way from Nora Dowling on our webinar team within the next 2 weeks. So be patient. We have a lot of credits to process, but they will be there in your inbox in the next 2 weeks. If you're joining today on mobile and you can get to a desktop, we do recommend that for a better viewing experience. It'll also be easier to answer those polling questions. At the end of the webinar today, we're going to have a brief survey. It's just a few questions. If you could fill that out, we would greatly appreciate it. We're always trying to provide the best webinar content for you, and we can only do that if we're learning and growing, and always great to hear from you on how your experience was. If you have any questions at all today, feel free to place them in the chat, or you can always send us an email at webinar@rectanglehealth.com, and we will be sure to get back to you as soon as possible. And then lastly, we also will be sending out the recording. So if someone from your practice couldn't join for whatever reason, you need to hop out early, that recording will be coming your way along with a handout. So you'll get that within the next 24 hours following the conclusion of the presentation. And then we do have some really great webinars coming up. I'm going to put the links to register to those in the chat. So we have Clocked In Time Management Strategies for Successful Practice, a really great presentation that we're hosting with Laura Nelson on August 8th. And then we also have a really unique presentation called Make September the Best Month for Your Practice, all about overcoming some of the September obstacles. That'll be August 14th. So I'm going to put the link to both of those in the chat. So if you'd like to join us for another webinar, you can sign up. And then I'll also be putting a link in the chat to schedule a demo of our HIPAA compliance solution. We're offering lunch on us, a really great promotion. If you sign up and complete a demo, we'll have more information on that later in the presentation. So with that, I am very excited to introduce our speaker today, Leslie Canham. Leslie is a certified and registered dental assistant and is certified in dental infection prevention and control. She specializes in OSHA compliance, infection control, HIPAA, and dental board regulations. And as a certified speaking professional, she lectures nationally and internationally and has over 50 years of experience in dentistry. And she's a great friend of ours here at Rectangle Health. So with that, Leslie, I'm going to send it into you.
Thank you so much, Jacob. Now, everyone, we are getting ready to go through a very rapid fire training today. I want to cover HIPAA terminology, patient rights and requests, viruses and ransomware, and how they can compromise data and lead to costly fines and citations, a little bit of computer etiquette, and some tips for mitigating breaches. I also want you to have reliable resources that you can refer to. Now, the reason this is so important, last year, 87 million patients had their information breached. Now, we've had cyber attacks in dentistry that have really disrupted our dental practices. In August of 2019, there was a ransomware attack that encrypted files of 400 dental practices. And then later that year in November, ransomware attacked a Colorado information technology company. It impacted 100 practices, leaving them without access to their patient records, their appointment schedule. Can you imagine what that would look like if you walked into your practice, let's say on Monday morning, and your computer had some strange message on it and you couldn't access any of your information? Well, you might think, gee, they're going to leave us alone. The cyber criminals and gangs are going to not be picking on the smaller dental practices. But the fact of the matter is that they do, because we're considered to be low hanging fruit. We don't typically have large IT divisions of our dental practice that's going to oversee our firewalls and our ransom, making sure that we have virus protection. And so what we have to do is be vigilant on our own and follow best practices. Now, being a smaller company, you may feel a little bit insulated because the bigger companies are obviously the ones that are going to have more data to mine and maybe pay a bigger ransom than a dental office would. The American Dental Association was hit with ransomware attack. It was in April 25th of 2022. And interestingly enough, I was on the ADA website that day, and I couldn't get to some of the documentation and publications that I wanted to pull up. And the message was, ADA is experiencing technical difficulties. We appreciate your patience and are working to get systems running smoothly. Well, it's an interesting thing because this cyber attack caused, I guess you could say, compromise of the members, the American Dental Association members' email and of their online chat, their membership software, some of the information about paying with credit cards. Many times members pay their fees or buy products with credit cards. So it was certainly a big disruption for American Dental Association to have to deal with. And then you might remember just last year on October 15, Henry Schein announced that they had experienced a cyber incident that may have compromised customer data. So this happened in October. The same cyber gang attacked the following month. And this year, I think the biggest disruption that we've had in dentistry is the February 21st Change Healthcare cyber attack. Dental offices that were impacted experienced delays in claims and revenue cycles and disruptions and impacts to their e-prescribing. The issue there, and what Change has indicated, is that they process 1 in 3 healthcare claims in the United States. It was hit by Black Cat ransomware, forcing its systems offline. Black Cat claims that it stole 6 terabytes of data from Change, including medical records, social security numbers. And since this time, Black Cat has received $22 million in Bitcoin, according to Reuters. The American Hospital Association, had called it the most significant cyber attack in US history. Now, before we go on to a more significant cyber issue, I want you to know the update with Change Health is they finally do have information that dental practices who were impacted can now share more information with their patients about what happened, not specifics, but they can tell their patients to be vigilant in monitoring their credit. And this, what they call substitute notice from Change Healthcare, has all the information on how you would monitor your credit, and you might want to freeze your credit. You might want to be very careful on what you're doing and look for suspicious activity. So let's go up to just this last week. July of 2020, businesses and governments worldwide were disrupted by a major IT outage, and some of you may have been affected. I know I was personally affected. I couldn't get into some of my programs, and it looked like maybe the programs had system updates or maintenance. But I'm kind of like the person that keeps trying and keeps trying and keeps trying, thinking it's on my end and it's my fault. And then I discover the next day that there was this huge global outage, and that the outage was affecting not only smaller businesses, but it was affecting Microsoft users from bigger businesses. And you've heard about the airline fiasco. Even Delta Airlines hasn't been able to get back online. Banks, IRS, the court system, the Los Angeles court system was shut down as well. So you can imagine the kinds of things that can happen. Dental practices are still experiencing delays due to that Change Healthcare. I have a client who had told me that they had to stop doing certain things, stop seeing patients, and that they had to try hard to find other ways to get revenue because all of their insurance payments for 2 months had been held up. So, as you can imagine, that could be pretty disruptive to a dental practice to not be able to collect money and at the same time not be able to produce dentistry. So that all leads down to the final question: how can we protect patient data and comply with HIPAA? So we'll start out with just a little bit of getting you acquainted with some of the terminology. You probably already know that HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. In 2003, that's where we got our introduction in dentistry to the privacy rule that protects patients' privacy. Not everybody was online at that point, but we did have computer systems and we needed to make sure that the data in those systems was recoverable. That seemed to be our only real big concern. But then just a few years later, the security rule kicked in, and that's where more dental offices were online and transmitting insurance claims and communicating with patients by email. And then a few years later, the breach notification rule became effective. And the breach notification rule recognized that this data that's going back and forth electronically could easily be breached. And so this notification rule requires dentists and covered entities and their subcontractors or their business associates, given them a specific set of rules that they have to comply with, and they have to notify anyone who has had their data compromised while it was in their custody. The 2013 Omnibus Rule combined all the sections of breach notification, privacy, and security rule into one package. There's been another addition to the HIPAA requirements from Health and Human Services. They added something called the Safe Harbor Rule. And the Safe Harbor Rule, it actually is in place to say, hey, this might help to reduce any kind of amounts of penalties that are imposed of and maybe the time that is taken for an audit by HHS. HHS means Health and Human Services. They're the HIPAA police, I guess you could say. And in a nutshell, what they say with the safe harbor rule: if you're a covered entity and you adequately complied with best recognized security best practices for at least 1 year, then your penalties would likely be less. So that leads me to the next vocabulary word: is who's a covered entity? Well, covered entity, any dentist that electronically transmits patient protected health information in connection with a transaction like insurance claims or benefit eligibility, and even now other communication, is considered to be a covered entity. I don't even think there's really any more dental practices left that are not covered entity, except for those who are still typing out their insurance forms and have everything on paper and nothing in an electronic manner. So let's ask ourselves, what is this recognized best security best practices? I Googled it because that's kind of a broad brushstroke, and I came up with CIST and NIST, and CISA and NIST. So CISA is the Cyber Security and Infrastructure Security Agency, and on their homepage they have cybersecurity best practices. This is one of the resources that I want to make sure that you have available to you so that you can see what cybersecurity best practices are. And I have in your handout that you'll be getting by email, there's a couple of links that will lead you to some of these resources I mentioned. NIST is the National Institute of Standards, and it provides a framework that outlines best practices. So let's say you have an IT company that's managing your communication between your hardware and your software, and perhaps they're not educated on HIPAA because your IT company doesn't deal with medical and dental and hospital. Maybe they're just your friendly neighborhood IT person. They need to know what it is that they're responsible for. So I'm going to just have a minute here. Jacob's going to bring up the first set of polling questions before we go on to some more terminology. Jacob? Please answer the question. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. Is that true or false? We'll give you a moment to respond. And then I'll have Jacob close the polling down when he feels that it's ready to go.
All right, we'll give everyone 5 more seconds here, get in those answers. All right. 95% said true, Leslie. So we're doing pretty
Yay.
good here.
Good, good, good. Okay, so now we're going to move on a little bit more terminology to be acquainted with. Health information, protected health information, that's PHI and EPHI, and treatment, payment, and healthcare operations. You see these terms used a lot in the HIPAA rule, and you see it on your notice of privacy practices. So, health information is information that's created or received by a dentist that relates to a patient's past, present, or future mental health or condition. So many times in dentistry, we don't really collect data on mental health, but again, this is a broad term. Or their past, present, or future payment for provision of healthcare to a patient. So that's what health information is. It becomes protected health information when it's individually identifiable. So anytime there's a patient's name or identifying information, date of birth, social, now it's considered PHI, protected health information, and that's information that's transmitted in any form or medium, including orally and on paper. Protected health information, or EFI, includes information that's transmitted or maintained in an electronic media. Now let's move on to healthcare operations. Healthcare operations might be like quality assessments. Some of you have had the insurance company like Delta Dental come in and audit your practice. Maybe look at your charting, look at some of the things that procedures that are being performed. In hospitals, they may review provider competence and qualifications. Sometimes in the larger DSO world, there's oversight for providers, medical review, and then business management and admin activities. So these are healthcare operations. The next thing we need to know is, what is a risk assessment or a risk analysis? A risk assessment is a accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information that is held by the covered entity or the business associate. As I mentioned before, business associates are liable as well. If they breach data from patients, they need to account for that and report to not only the dentist who provided the information, but there's other steps that they have to follow. So this accurate and thorough assessment will help you identify risk and vulnerabilities of patients' protected health information and electronic protected health information, PHI and EPHI. Risk assessments are required. That's part of the HIPAA rule. And it's actually a good thing that it's required. You know, it's sort of like we're required to take CPR every 2 years to keep our CPR certificate up. Well, that helps you to stay fresh on it, and it helps you to see if you're not doing it right. So his risk assessments are required, and it helps you to determine where more safeguards are needed. And we'll spend some time talking about security and safeguards when we get nearer the end of our webinar. I mentioned business associates. You might say, well, who or what are business associates? A business associate is anyone who creates, receives, or maintains or transmits protected health information or electronic protected health information, or provides a professional service that requires disclosure of protected health information. This might include your answering service. If you have a human answering service and a patient calls with an emergency, they might say, what's your name? What's your emergency? The name and the medical condition now become protected health information. A document shredding company that would shred your old records, your old paper records, now that you're likely electronic health records. Your billing service, if you have an outside billing company that submits insurance claims or does collections for you. Your computer and IT support company, whether it's a large company that does a practice management run by a well-known dental company, or whether it's your neighborhood IT support person. They're all considered business associates. Now, you might not think about this, but if, let's say, you have a business coach or consultant, imagine I'm in your office and I'm a coach for front office collection and communication skills, and I ask you to give me the accounts receivable aging report for everyone over 90 days. And I sit down and I demonstrate to you by calling some of your delinquent patients to make a collection call. And so I have access to your patient's information. I see their name, their health condition, what they owe for that. So you would need to have a business associates agreement with me. If your accountant is involved with any transactions with patient accounts, that would be a business associate. And then the practice management software company, the company that you have for your scheduling and for your billing your insurance and for all of your record keeping forms in your computer, they're business associates. So go to the websites of your vendors like Dentrix, Shine, Carestream, Eaglesoft, Patterson, and in most cases, you can download their business associates agreement that you can sign. They've already pre-signed it, and then you can keep that with your collection of business associates agreements that is to protect you or your practice in the event a business associate has a data breach. You have a contract with them or an agreement with them that they must notify you. So, who's not a business associate? Delivery services, postal carriers, insurance companies, insurance issuers, governmental agencies, dental labs, pharmacies, employees, or janitorial service. You might think, well, gee, a janitorial service, they're in my office after hours. They could maybe see patients' records. They could see some of the things we have set up for the next day for patients. So they're not considered business associates. Employees are not either. But let's say that you wanted to make sure that your janitorial service understood that they aren't privy to any of the information that they see in your dental practice. You might have them sign a confidentiality agreement. I want to give you an idea of what happens when a business associate agreement is not obtained by the covered entity. Raleigh Orthopedic Group sent their records to a shredding company. And the shredding company destroyed their documents and did what they needed to do with their large, gigantic radiographs. As you remember, in the old days, the x-rays were huge for orthopedic. They were the orthopedic group, the actual medical group, was fined $750,000 because they did not have a business associates agreement with the document shredding company. Business associates, again, are required to notify the dentist of any breach. And the business associates agreement is something that you'll be able to obtain. It's not something you probably want to write yourself or spend money to have an attorney write, but within your HIPAA program that you should have, there would be a business associates agreement where you could have your vendors or your business associates sign your business associates agreement or provide you with theirs. Now, again, the whole deal here is that HIPAA is telling us in dentistry, we got to protect patients' data. And the way that we do that is raising awareness. We have to avoid breaches so that data doesn't go out to cyber gangs and ultimately protect the reputation of the practice. So I've jotted down in the handout that you're going to get 10 things that dental teams needs to know to make sure that you accommodate this protection of patient data. Let's start with tip number one. Patients have rights, and they have a right to obtain an accounting of disclosures. Disclosures means where did you release the information for the patient? You might say, well, we billed an insurance company, we sent a statement to you, and then there may be unusual disclosures. Perhaps there's a subpoena for a patient's dental record, or perhaps there is some other type of situation where a patient's record would need to be accessed by public health service. Maybe there's an outbreak in your community of a bloodborne pathogen, so they may ask to access patients' records. So if the patient's record is something other than the usual things that you do with your billing, if your insurance or collections with the patient, then the patient has a right to know where else their information has been released. Other rights that they have is regarding their actual records themselves. They have the right to access their healthcare records. They have a right to a copy of their dental records. Then they have the right to inspect their dental records. And HIPAA takes this very seriously. Dentists must release records in a timely manner, and they only charge a nominal fee for reasonable costs for copying and mailing the records. And when I'm talking nominal fee, I'm talking pennies, like 10 cents per page, 50 cents for, they said, for microfiche, which is kind of an old term. And the cost of mailing, whatever it costs you to put something in an envelope, or maybe you send it in a priority envelope. So whatever the reasonable costs are. And also is taken into consideration if you have clerical time, there's a little bit of clerical time for someone to put their records together and then to send them out. Patients have the right to request restriction on disclosure, so we have to honor that as well. They may say, I don't want you to share information with my wife or my husband, or you may have an elderly patient who is brought to the dental practice by their kids, their adult children. And that elderly person may say, I don't want you to share my dental condition or needs with my kids. I'm capable of making my own decisions regarding my own health care. So that's a kind of restriction that you might get. Or you may even have a restriction where it's something that's pretty serious, dangerous. Maybe you have a patient who has a restraining order against a spouse that's been violent or has attacked the family. They may say, do not release my address or my phone number to my ex-husband or to my ex-boyfriend or girlfriend because I have a restraining order and I don't want them to know where we live, and I don't want them to have access to my phone number because they harass me. We need to make sure that the dental team honors the patient's request to restrict disclosure. Don't make a mistake of letting that information out. Be sure that you highlight somewhere in your practice management system or on the patient's paper chart, if you have it, that there is a restriction on disclosure. And you don't have to say what the restriction is, but it requires that somebody look inside the patient's chart or record to see what it is that we are restricting. And by the way, there are forms for patients to fill out that ask you to restrict disclosures. So a signature on a form, and again, if you have a proper HIPAA program in your dental practice, you will have those forms at your fingertips. Another request that patients sometimes make is they'll say, don't tell my insurance company that I had this treatment done. And you might think, well, that's illegal, but it's not. HIPAA trumps the insurance companies. And if a patient has paid in full for their services for treatment, out of pocket, it could be cash, it could be credit card, it can be one of the companies that does patient financing, it can even be Aunt Thelma that wrote a check. And what this right for the patients is they get to pay for their treatment and tell you, do not bill my insurance company, don't even tell my insurance company. And the reason they might do that is because they may want to reserve the insurance funds for that same procedure sooner than the insurance would allow it. Here's an example. A patient is a teacher, and the teacher has insurance that pays for her denture every 5 years. Well, one day her little dog grabs that denture, runs off with it, and destroys it. So she needs to make a new denture. And this is a fairly new denture. She only had it made last year. Her insurance is not going to pay for it. Her insurance will decline it because there's a 5 year waiting period for major services like dentures. They'll pay for it in 4 more years from now, but not today. So the patient needs a new denture. She's going to pay out of her pocket because she can't teach without having her front teeth. And so she says, do not tell my insurance company that I had this denture done. And the reason why is that they'll add the 5 year clock to this new denture. And so she'd have to wait another 5 years. Otherwise, if she pays for it out of pocket and restricts disclosure to her health insurance company, then they don't. The insurance company will be eligible, make her eligible to have another denture 5 years from the last time they paid for it, not 5 years from the last time the patient paid for it. So we have to honor those rights. We have to have a way of communicating on our team what those rights are and what those requests are from our patients, because if we misstep here, the patient could complain to Health and Human Services, and that might trigger an audit. Now, the best way for you to become familiar with all of your patients' rights is read your notice of privacy practices. So I'm going to ask you, just think to yourself, have I read my patient's notice of privacy practices? Do I know what I'm promising my patients? Well, you might say, okay, the notice of privacy practices tells the patient how their health information is used by our practice for treatment, payment, and healthcare operations, and it provides patients with information about their rights. If you don't know what that says, read it because you're obligated to adhere to the HIPAA requirements to honor your patient's request and to know what their rights are. We give all of our patients the notice for privacy practices, and we post the notice of privacy practices in our dental practice in a visible and prominent place. If you have an update, let's say that you decide to charge for duplication of records, and you may say, we have a $25 flat fee for copying x-rays and sending records, and that includes all of our costs, including mail postage, whatever. When you change a fee, you would have to include that on your notice of privacy practices. Does that mean you need to send that notice of privacy practices out to all of your patients again? No. All you have to do is change the posting in your practice with the new notice of privacy practice, and that actually informs patients of the updates. Remember that your notice of privacy practices, the full version, needs to be on your practice website if you have a practice website. And here's a tip. Health Insurance Human Services, the HIPAA police, audited dental practices that did not display the notice of privacy practices on their website. And what they determined was if they didn't comply with this one simple part of the regulation, they're probably not in compliance with the rest. So it can trigger an audit for your practice. So, quick review and recap. The notice of privacy practices is given to the patient at their first visit. You post the notice of privacy practices in a visible and prominent place in your dental practice, and you also have it on your practice website if you have a practice website. Jacob, let's go on to polling question number 2 and see how well folks followed along with us.
All right, let's do it.
So, HIPAA regulations are federal standards that protect, and you get to choose.
Give everyone about 10 seconds here to get in their answers. Wow. All right, Leslie. 100%.
Everybody was with us. That's good news to,
Wow. That's
yeah.
impressive.
So let's go on to tip number 3. Dental teams must comply with HIPAA. Written plans and policies are required. So because these are mandatory, in the event that you have an audit, the written plans demonstrate how your practice will adhere to HIPAA regulation or has adhered to HIPAA regulations. Tip number 4, HIPAA violations can subject you to sanctions, termination, and even possibly criminal prosecution. So while the dentist or the employer is obviously the last place the buck stops, team members can also be subject to possible criminal prosecution by abusing patients' data. Now, we know that we've heard of people embezzling, we've heard of people sometimes stealing patient records because they go to a new office. Sometimes hygienists have a following of patients and they move to a new office. If they were to contact all those patients and say, I now have moved to this new office, that would be violating. There's no reason for them to do that. It violates HIPAA. HIPAA really is protecting the patient's data. It's only their data is only to be used for treatment, payment, healthcare operations, and not healthcare operations in another facility. It's in the facility that you are working in currently. HIPAA violations sometimes involve celebrities, where celebrity information is revealed at UCLA Medical Center. There are employees who leaked and shared and viewed medical information on Michael Jackson, Farrah Fawcett, Maria Shriver, Britney Spears. So you can think, gee, the hospital is ultimately responsible, but these employees in some cases got fired. There are settlements and civil penalties. So we don't have very many HIPAA citations against dental practices. Where they get us in dentistry is with the settlement fees, the remedial action, and the civil penalties. One dentist paid, Dr. Broccoli paid $30,000. And then if we go down a little further, Dr. Phillip paid $50,000 in penalty. There was a psychiatric clinic that outside of dentistry, but they got hit with a $28,000 fine. And then Northcutt Dental Fairhope LLC also got hit with a $62,500 fine for potential violations. Now, potential violations, it's not the actual violations, potential. HIPAA violations can lead to sanctions termination and may subject you to criminal prosecution. So let's take a look at us, the people who work in a dental practice. Um, know that according to the studies, 9 in 10 health data breaches are caused by employee mistakes. What's a breach? A breach is acquisition, access, use, or disclosure of unsecured protected health information in a manner that is not permitted under the HIPAA privacy rule. So examples are if you have unauthorized acquisition of a patient's name all by itself, that's not a breach. But if it's name and insurance information, or name and social security number, or name and driver's license or ID, or name and health information, or I mean financial information, credit or debit card, and then medical information. Unauthorized acquisition of a patient's name with any of these is considered to be a breach, and that triggers breach notification. Our patients must be notified if their unsecured protected health information has been breached as soon as possible. If more than 500 patients' data has been breached, it must be reported to Health and Human Services without delay. If it's less than 500 patients, then it must be reported by the end of the calendar year to Health and Human Services. If those same 500 patients reside in the same geographic area, the breach must be reported and announced on local media, whether it's a television spot, a newspaper ad, a magazine, a radio spot, things like that. The word has to get out, and that can be reputationally harmful for a dental practice to have to announce that they have had their dental records compromised. Now, if you're uncertain of how you would handle breaches, you might also refer to CISA and NIST for recognized best security practices, how to prevent breaches. We'll talk a little bit more about that. But I would like to bring up another polling question, Jacob. Let's go to question number 3.
All right, let's do it.
Dentists are considered covered entities if they transmit patient information in electronic format in connection with a transaction covered by HIPAA. True or false?
All right, answers trickling in. Give everyone a few more seconds here. I'm really impressed, Leslie. They're doing good today. 96% said
Got a
true.
smart group of people. Okay, so moving on to, we'll close that poll up and tip number 6. External hacking or incidents accounted for 84.6% of all breaches in 2022. And as we know today, we are seeing all sorts of external hacking and incidents that are accounting for all sorts of malicious activity. So we need to secure our computer access to authorized users only because there is danger in clicking on links in emails. There's danger in opening malicious email attachments. So we need to make sure that only the people that need to access patient data have access to those computers, and they're well trained on what they should click on and what they shouldn't click on and what they should have that antenna up on to make sure if they have a question to go with your gut feeling. If you think this is malicious, check it out with your IT person. I'm going to start with tip number 7. Phishing emails can trick you. Sometimes cyber criminals, they consider themselves the mafia. They're pretty smart and they make a pretty good living off of us by tricking us. They may send an email to you that looks like it's from somebody you know. Let's say you're a general dentist and you have an orthodontist or an endodontist, periodontist, oral surgeon in your neighborhood. And so you may get an email that looks like it's from your local orthodontist. And your local orthodontist, their email address is Dr. Jim Lott at smiles.com. But the criminal is going to be an imposter and send you an email from Dr. Jim Lott at smiles.net. And it'll say something like, would you kindly take a look at this attachment and can we call on the phone and discuss this patient's case? And sign off as the orthodontist in town. Well, the minute you click on the link, it ends up being a link that unloads havoc into your computer system. So we want to be vigilant and make sure that we check for any email addresses that might be from imposters. If an email requests account information or numbers like credit card numbers or contact information or date of birth or social, it's a good idea to follow up with a phone call to whatever provider, insurance company, or whoever is asking for this information. Don't go with the phone number on the email. You look it up yourself if it's a company you're connected with. And if you see an email that looks suspicious, but you might think it's important. Here's one that was actually Bellingham IT wanted to give us an example. So they shared this information. If you have an email, it says the Outlook team, and it tells you you have reached your storage limit for your mailbox. And it also tells you that you're going to not get any more emails, or all your emails are going to be deleted unless you respond. And they ask you to respond by clicking something to restore your storage. Now, a lot of people would think, oh, gee, great, I got to do this. But again, that is actually a very fishy thing. If you roll your mouse over the sender's name, you might see what the exact name actually is. Now, this does say that it's from the Outlook team, but it may say from the Outlook team, and then you see flying high at AOL.com. Is that from Outlook? It certainly isn't. Tip number 8, use the minimum necessary standard when responding to a request for patient information. When a request is made, and you might get this from a person, from an insurance company, from a provider that you coordinate with, a specialist, make sure that you're using the minimum necessary. Use or disclose only the amount of information needed to accomplish the intended purpose. Now, if the request is from a healthcare provider involved in the patient's treatment, is that healthcare provider authorized by the patient for you to communicate with? So if there is a little bit of latitude within treatment, payment, and healthcare operations, where if you refer a patient and it's known to the patient that you're referring to an endodontist, and the endodontist calls and asks a question about it, then we really do have that's within treatment, payment, or healthcare operations. But there may be a request from the endodontist for more information. Like, for example, they might say, well, thank you for referring Mrs. Jones. Can you tell us what insurance Mrs. Jones has? Oh, good. We accept that. And then how about, can you tell us, has she met her deductible? How much has she used in your office this year? What is the group number? Does she go by date of birth or social? That's more information than you're authorized to give out. You're authorized to give out information regarding the endodontic emergency, not necessarily all the other things. What if Mrs. Jones never makes her way to the endodontist, and now they're in possession of all this information that's protected health information? Okay, let's go to polling question number 4, Jacob.
Let's do it.
The privacy rule limits how dentists may use individually identifiable health information, so select the best choice. It's a
All right,
tricky one.
give everyone a few more seconds here. All right, looks like we have 89%. Oh, it's moving. 80% said treatment, payment, or healthcare operations.
That's right, because all the other things are within the corral of what you can do with HIPAA, under HIPAA. Tip number 9, and let's close that media. There we go. Social media, cell phones, artificial intelligence, smart devices might violate patient privacy. So let's start with the easy one. Think before you post on social media. Don't discuss patient treatment in social media, even if the patient initiates the post. Never post about your workday, bad or good. And if patients' names or photos are posted on, let's say, your Facebook business page, you must have written permission. Now, also for social media, we cannot communicate with patients regarding their treatment or their practice. Employees should not do this even from their own personal accounts. I know there's a little bit of information about how employees respond and how they behave outside of business hours, but we could actually be breaching patients' information if we're talking about anything that has to do with their oral condition on our Facebook page. So that's something we want to make sure that we put some kind of standard on that, to have any communication with the patient surrounding treatment or the dental practice, to have the patient call the office, or to state that you'll call the patient on the next business day. There was one office that actually had a fine, a citation. It was one of the first ones, Elite Dental Associates out of Texas. They paid $10,000 in a citation because the doctor responded to a patient on Yelp using the patient's last name and health condition. Mind your cell phones. Remember that when you carry a cell phone with you, it has a very good microphone, it has a very good camera, and you might accidentally butt dial. I know I do that all the time. I don't realize it. And you could be recording an entire conversation simply because you bumped your phone that was in your pocket while you're consulting with a patient. There should be policies set on how your practice handles devices like business computers, internet access, personal cell phones, what may and may not be done or used at work. That way we can make sure that we have a firm policy of where those cell phones will go. Remember, there's a danger when people use office computers for personal business. There's danger in downloading software. There's danger in connecting your own personal USB drives into a business computer. And there are many dangers out there lurking in opening email attachments. So let's protect our computer systems against those threats by raising our awareness. And that leads me to tip number 10, which is the weakest link in any computer system is the user. It's not necessarily the system, it's the mistakes that we make. And so what I've included in my handout, besides 10 tips of what dental teams need to know, which you covered, there's also 10 tips on cybersecurity. And you can, the handout is clickable links. It's a PDF from, actually is from Health and Human Services, and it has various different links that are expanded for much more information to give you greater detail than we could possibly go into in this 1 hour that we have together. And I'm kind of glad because when it comes to cybersecurity, here's my disclaimer. I'm a little chicken. I'm actually terrified of what happens beyond my computer monitor and in the box itself and on those wires that go out to the cyber world. So in your handout, there's the government website, healthit.gov, with the 10 top tips for cybersecurity. And I'll just briefly review them. And I want to let you know that each one of these tips, which is listed here on the checklist, is clickable and it opens up a whole window of information and explanation. It makes it easy for you to have team meetings and review certain parts of establishing a safety and security culture in your practice. You don't have to do it all at one time, but reminders are important. So that's the first tip is establish a security culture. And there's some suggestions on how you might do that with your team. The next tip is to protect mobile devices, smartphones, tablets, portable media storage, or other handhelds. And today we have many mobile devices that are in a dental practice. We want to maintain good computer habits. As we mentioned before, don't click on malicious emails. Don't download things from the internet unless it's something you have to download. Your IT company requires you to, or your practice management support company requires you to. Make sure you have a firewall. Oh, for heaven's sakes, there's many times that business firewalls are either not kept up to date. They can actually, there's possibility that you could still have an attack even with a firewall. Sometimes the cyber gangs can collect IP addresses and get around your firewall. So look at the best practices there. Antivirus, any kind of antivirus protection, install and maintain it. Make sure that that's something that if a team member is going to do it, that they're well versed in what they're doing. Your IT company is clearly the ideal company or person to maintain your antivirus and your ransomware software and your firewall and all the other parts that they're more educated in than we are in dentistry. We also want to plan for the unexpected. So take a look at that and what your contingency plans might be should you lose access to your data, what things you could do to be able to be up and running again. Control access to protected health information. So that means we want to know who's accessing our information. We want to control it to the people who have the right to access it. So our team members that need to get into the computer and bill an insurance or call a patient, they have access. But maybe an ex-employee that was left the practice 2 weeks ago, they shouldn't have access. That leads me to passwords. We need to make them strong and we need to change them often. And boy, do I hate that. It gets my goat every time I'm asked to change a password, but I understand it's for my own protection. In the past, my passwords were super simple and easy for me to remember because I don't want to have to look up my passwords all the time. I found out that it's pretty easy to hack an easy password. The purple shows how quickly, instantly, a password could be hacked, even if it has 10 characters. And even if it has a combination of lowercase, uppercase, maybe some punctuation, it gets harder when you get down to 11 characters. So it might take a few more minutes. When you get down to 13, you might have 3 weeks before a hacker can get into your password, up to a year. And then if you take a look at number 14, 14 characters, 51 years, 800,000 years, 9 million years, all the green and all the yellow, I vote for that. I don't want them to have my password. So a strong password. And then one other piece of the puzzle, you're probably getting this already, multi-factor authentication will help prevent unauthorized access. So really passwords and preventing unauthorized access is your first line of defense. Multi-factor authentication is they send a text message with a code, and you have to copy that code in order to log in to whatever it is you're logging into. And it's funny, everyone's using this these days. I set up an account with a Cheesecake Factory so I could make reservations online. And when I set up my account, they sent me the multi-factor authentication before I could set up my account. We want to limit our network access, again, only to those people who need that information in order to do their job. And we want to control physical access. So physical access to our building, how do we lock the doors? Do we have alarm systems? How are our servers stored? Are they stored securely? Are they in a server closet? Are they bolted to something? Are they encrypted? There's all sorts of different things that will help us, but stopping a person from getting in the doors and actually walking out with your system is a good line of defense. So the weakest link in any computer system is the user. It's your responsibility to have awareness at top level, especially today, especially when there are all sorts of cyber attacks affecting us worldwide. Your job is to be aware, find the gaps in your systems, and take the steps to correct those gaps. It's something you may not be able to do on your own. So that's where you look to the experts for help, support, advice, guidance, assistance, and information. Because the bottom line is every single patient deserves a safe and secure dental visit every single time. Utilize the available resources that will help you maintain HIPAA compliance. And with that, I want to turn the microphone back over to Jacob, but first, just to let people know how they can get a hold of me, just go to my website, www.lesliecanham.com. Here's my QR code, or connect with me on social media. So, Jacob, any final words before we turn over?
Yes. So with that, our CE is officially over. Thank you, Leslie, so much. I'd now like to pass it into Josh Stoll from the team at Rectangle, who's going to talk a little bit more about HIPAA compliance here and how you can put a solution in place to your practice that's going to assist and make things easy. Leslie talked about a lot today, so I'm sure some of you guys are like, I do that, I don't do that, whatever it may be. So Josh is going to give you a quick breakdown here. So Josh, sending it into you.
Thanks, Jacob. And thanks for all for attending the CE. Leslie, that was amazing. Great refresher for me as well. I feel that what we learned about today was that, HIPAA is there to protect your patients, but who's there to protect the practice and to support the practice? And HIPAA compliance is crucial, but it can be incredibly challenging to manage all of this on your own without support. And Rectangle Health, we address all of these challenges head on by providing an all-in-one automated compliance solution called Bridge Compliance. This is a software that you can delegate all your responsibilities of compliance to, and we assist you 100% of the time year round, ensuring that your patient's health information is safe and secure, maintaining a safe workplace for your patients and your staff with OSHA, helping you reduce really simplifying these manual processes that are taking away time from patient care with our platform, and keeping your staff informed and up to date with all of the changes going on in healthcare with automated training modules that can really assist you and help simplify a lot of this for your practice. Leslie, next slide, please. This is a sneak peek into our platform. Our software has been around for over a decade. We manage and guide you through the entire compliance process for your HIPAA compliance management and OSHA. We have easy to use tools for your HIPAA risk assessments that Leslie went over today, walking you through those, ensuring that you have the necessary documentation, and ensuring that your policies and procedures that you have, many of which you already have probably today, maybe you need to dust off the HIPAA manual and go through them again, but we can really help ensure that you're properly implementing those policies and procedures that Leslie touched on today. We also provide over 1,400 CEUs for our dental practices with ongoing support as well, and keeping those training modules up to date. That way you're not falling behind on outdated training. Our compliance module will also include PCI compliance to help you protect cardholder data when it comes to accepting payments from your patients. And most importantly, something I want to touch on before giving it back to Jacob is that we're the only compliance team out there that provides something crucial that a lot of smaller practices fail to implement, and that's cyber insurance. Our platform provides financial protection in the case that you have a data breach or, God forbid, a HIPAA audit. We actually help protect your practice and provide financial protection. So, all in all, with Bridge Compliance, we not only just help get you compliant, but we keep you compliant, and we have your back in the event of an audit or a breach. So I know, Jacob, you have an offer that you want to make to the attendee demo and meet any of you that are willing to sit down and go through your practice and address some of these requirements.
Yeah, absolutely. Thank you so much, Josh. So I just put a link to book a demo in the chat if you're interested in what Josh talked about and getting Bridge compliance for your practice or just learning more about it. We're giving your practice lunch on us via DoorDash gift card. So fill out that demo form and then complete a demo by August 30th, and we're going to give your practice lunch on us. So just a little thank you from us for listening to what we have to say. And really, at the end of the day, we're here to help your practice automate and manage HIPAA compliance to the best of its ability. So with that, I'm going to give a few final reminders here since I'm seeing a few questions pop up in the chat. So for those of you who popped on late, CE credits will be coming your way within the next 2 weeks. So be on the lookout for that. They're going to come to the email you registered from Nora Dowling on our webinar team. So be on the lookout for that. I am going to be sending a link to the recording and handout within the next 24 hours. So be on the lookout for that as well. And then at the end of the presentation here, you're going to be prompted to complete a brief survey. It'll take you less than 5 minutes. Please do so we can learn from you and continue to improve upon our webinars. But Leslie, I'm seeing some great feedback here in the comments. So everyone said you did a great job, and I agree with them. That's a lot of information for an hour. But thank you so much, everyone, for taking the time and being with us today. If you want to book that demo, like I said, the link is in the chat, and we'll also be sending it out in that follow-up email. And we're going to get you out of here 2 minutes early. So thank you so much. Have a wonderful rest of your Wednesday, and we will see you all soon. Take care. Thanks, Leslie.
Most welcome.